Lori's Children's pauses gender affirming surgeries following Trump threat. Yeah, this is for anybody under 19 years old. Lori's Children's is part of Northwestern. Yeah, that's part of the whole merging. So they've been doing it for 20 years, though. And it's what the excuse they use, and they had to come out, I think it was 2 years ago, I did a video about it, and they had to come out and apologize, and yet they still kept doing it. And they use the excuse that it's for like children that are born with both parts, which is very, very rare, okay? This is a huge moneymaker. So the reason they've paused it is because, yeah, Trump has threatened he won't pay for it. They won't get any federal government money. That's the only way these people listen, because it's all about money to them. It's not about gender affirming anything. It's not about care. It's not about health. It's about greed, sickness, and it's about being falsely enlightened. It's why I talked yesterday about or last night about the false enlightenment path. This is where it leads. It's just a greed-filled path. But this is how stupid Democrats are, I swear. So typical Chicago. On Friday afternoon, Equality Illinois, which advocates on behalf of the LGBTQ plus community, released a statement objecting to Lori's decision. Not only may this decision represent a failure to provide medically appropriate care to its patient. No, back that up, okay? This is not medically appropriate care. It never has been, not for children. Again, we don't let people drink until they're 21. There's a science behind that. So do you think you should be letting the kids decide, yeah, let me just chop my stuff off? No, this is darker than that. What I would imagine what would be uncovered with this, if they ever have somebody do it, is that the majority of the kids they did this to were kids in the state system. Those kids are not protected because the state is their guardian, because the majority of this is Medicaid. So these people that are, whatever they are, Equality Illinois, please, you don't know what you're talking about, and you're just doing the bidding for something wicked. If adults want to do it, fine. Fine, go ahead. But for kids, this has always been my argument. Stop this crap. I knew a nurse. I didn't work at Lori's, but she worked at Lori's back 20 years ago, because they've been doing it for 19 years. And she said there was a mass exodus when they loved working at Lori's. She said everybody loved working at Lori's. Then when they started doing this, she said there was a mass exodus of nurses. They didn't even necessarily work in surgery. They were like, no, we know this is wrong. We're not having anything to do with this. She said otherwise she had anticipated spending the rest of her career there. But a bunch of them left because they started doing this. Failure to provide medically appropriate care to its patients, but we are also exploring whether Lori's Children's may be in violation of the law by potentially denying care to trans patients. Gender-affirming care, which is not care, is essential, evidence-based, no it's not, and life-saving, and any rollback of such services puts vulnerable youths at risk. No, you put vulnerable youths at risk. You do, and you all do it because you either follow something wicked or you're just greed-filled. End of story. It's that simple. If everybody wants to complicate it and make it, well, no, there's this small percentage of people. Okay, I'm not talking about the small percentage. They've been doing it on a big scale, and the hospital does it, and they're pausing it because they know the federal government isn't going to pay for it. So then, of course, a Democratic Illinois Attorney General, Juan Raul, has vowed to protect access to gender-affirming care. So these people, in my opinion, especially when they're in these leadership positions, like a political leadership position, there should be something in place for these people to be immediately removed, because he's a danger to children. He's a danger to children. We know the evidence of the frontal lobe. I've been saying it for 4 damn years. Okay, that's an old evidence that we know. It's why we don't let kids drink till they're 21, because before that age they are not in a place to make decisions of that major of that's something that's that big, because they're too impulsive before the frontal lobe is fully formed. Frontal lobe houses impulse control. There's no way that all the science they did. All the science seemed to forget this. And nobody in the science or in the hospitals has told any of the Democrat Party, no, because they want to follow this path. Some want to follow it because of money, and others want to follow it for something more darker. He said, gender-affirming care is essential, life-saving medical treatment that supports individuals in living as their authentic self. Not when they're children. Not when there's children. Why do you have to push this on children? See, this attorney general in Illinois, he is a danger to children. Like, literally in every state when it comes to psych, okay, because I'm a psych nurse, we have things in place for those that are a danger to themselves or others. He is a danger to children. Like this, I'm so sick of this argument, because you have to erase the mass evidence we know about the frontal lobe. And somehow that's how good the media has just brainwashed people. In Illinois, the Human Rights Act requires healthcare providers to offer medical care to all residents and prohibits unlawful discrimination on the basis of sex, including gender identity. Okay, for adults, that's fine. You can offer that care to adults. For children, no. Because they need to grow to an age to where then they can make those important decisions. That's too massive of a decision. And I guarantee you, if anybody ever blows the lid off of this, it will show that the guardian that was making the decision to do this to many of these kids, it was done to kids in the state system, which would make it even more horrendous, that's been said before. So, but still, Lori's is pausing the surgery for the time being. No, they need to pause it altogether on youth. Like, this is why I said these hospitals, they're not going to back off. They're going to try to find a way. They're going to try to sue. But the only reason the hospital is pausing it isn't, this is what kills me. It isn't because they care. It isn't because they want to do the right thing. They're pausing it because they won't get paid if they keep doing it. Like, the ethical has just completely been lost in all of this. That's why I say this age of enlightenment that's gone on since the 1800s, it has been a false path of enlightenment. Everybody wants to talk about, no, I'm free, I should be able to cut my genitals off, and I should be able to do this, and kids should be able to do this, and kids should be allowed to be pedophiles are just people that love kids, and we need to change pedophile into mature adults that want children. And no, you know what freedom is about? Freedom is actually about knowing when you shouldn't do something.